Definition: cholesterol is a waxy substance that comes from the two sources, your body and food. Your body, and especially your liver, makes all the cholesterol you need and circulates it through the blood. But cholesterol is also found in food from animal sources such as meat, poultry, and full-fat dairy products. Cardiovascular disease. Heart and blood vessel disease, also called heart disease, includes numerous problems, many of which are related to a process called arteriosclerosis. Arteriosclerosis is a condition that develops when a substance called plaque builds up in the wall of the arteries. This build-up narrows the arteries, making it harder for blood to flow through. If a blood clot forms, it can stop the blood flow. This can cause a heart attack or a stroke. Application in medicine. Previous trials have shown that the use of statins to lower cholesterol reduces the risk of cardiovascular events among persons without cardiovascular disease. Those trials have involved people with elevated lipid levels or inflammatory markers. We randomly assigned 12,705 participants in 21 countries who didn't have cardiovascular disease and were at intermediate the risk of receiving rosuvastatin at a dose of 10 mg per day or placebo. The median follow-up was 5 years, 7 months. The overall mean low-density lipoprotein cholesterol level was 26.5% lower in the treatment with rosuvastatin at a dose of 10 mg per day, resulting in a significantly lower risk of cardiovascular event than placebo in an intermediate risk without cardiovascular disease. Pros and cons. Pros. It acts as a carrier for several antioxidants, enzymes, and vitamins, especially vitamin A and E. Increased vitamin D vitamin that helps regulate blood pressure and helps the immune system. Skin care. The waxy substance acts as a protective layer against damage from sun and wind. Cons. Can put you at risk for coronary heart disease, heart attack, or stroke. When there is too much cholesterol, tends to stick to the wall of the veins and arteries, forming layers that are growing and obstructing blood flow, called arteriosclerosis. Smoking, alcohol consumption, obesity, and physical inactivity are the most common causes of lack of high-density lipoprotein. Issue applied in Ecuador. It is recommended that a proper diet, that is to say, have the lowest possible consumption of animal fats, including frying, leave the snuff and alcohol, reducing salt, and exercise. The use of drugs such as statins, fibrates, and resins help lower low-density lipoprotein or bad cholesterol and other increase high-density lipoprotein or good cholesterol.
Both niacin, vitamin B3, and pantothenic acid, vitamin B5, can help raise HDL levels in the blood. But before you take them, consult your doctor first. Cholesterol may have a bad reputation, but HDL is one type of cholesterol that you shouldn't fear. Learning how to raise good cholesterol levels can keep your heart healthy. and doing so can mean a happier and healthier life. How to raise good cholesterol levels. High-density lipoproteins, also known as HDL and dubbed as good cholesterol, help protect you against heart disease. This is the kind of cholesterol that you want circulating in your bloodstream. Having less than 40 milligrams per deciliter of HDL puts people at risk for developing coronary artery disease. Although the normal amount is 40 to 60 milligrams per deciliter, levels higher than 60 milligrams per deciliter are actually associated with lower risk of heart disease. In order to keep your heart healthy, here are ways on how to raise good cholesterol levels. 1. Engage in aerobic exercises. According to recent findings, the duration of exercise, rather than the intensity, is more important in increasing HDL levels. Some good aerobic exercises include jogging, walking, and bike riding. 2. Maintain a normal weight. Your body mass index should be lower than 25. This is especially important if a lot of your fat is concentrated in the abdominal area. Losing just 6 pounds can result in a 1 milligram per deciliter increase in your HDL levels, and losing weight can also decrease LDL levels. 3. Stop smoking. Besides being bad for your lungs, smoking decreases your HDL levels and increases your LDL levels. Simply quitting smoking can increase your HDL levels by 10%. Since quitting is not easy, you may want to talk to your doctor about effective strategies to quit smoking. 4. Drink alcohol in moderation. Too much alcohol, that is, more than 1 to 2 drinks per day, can also lead to heart problems. 5. Watch your diet. Reduce the amount of saturated fats and trans fats in your diet. Instead, eat more monounsaturated fats, the kind found in nuts, olive oil, canola oil, and avocados. In addition, consume more omega-3 fats, which you can get from foods like salmon, sardines, chia seeds, and walnuts. Do not make the mistake of ditching fat altogether, as a heart-healthy diet should get 30% of the calories from fat, with saturated fat accounting for only 7%. Aside from healthy fats, you should also eat fruits and vegetables, as well as soluble fiber, which bran and oatmeal contain plenty of. These contain phytochemicals that help raise HDL levels. 6. Cut your sugar intake. Studies show that the more calories coming from added sugar, the lower the HDL levels become. Cut back on empty-calorie snacks also high in sugar. For instance, instead of drinking sodas, drink fresh orange juice as a healthier alternative. However, you can make an exception for dark chocolate. Studies show that eating 50 grams of dark chocolate per day can improve the action of HDL. However, do not overdo it. 7. Take vitamin B supplements. Both niacin, vitamin B3, and pantothenic acid, vitamin B5, can help raise HDL levels in the blood. But before you take them, consult your doctor first. Cholesterol may have a bad reputation, but HDL is one type of cholesterol that you shouldn't fear. Learning how to raise good cholesterol levels can keep your heart healthy, and doing so can mean a happier and healthier life.
In conclusion, reducing the cholesterol level does not provide total protection against heart disease, but is one of the most important ways to reduce the risk. So it is necessary to keep a healthy lifestyle. Thank you.